Hey guys, welcome to a new episode of this PYQ session. I am the boss doc, and you are watching this from the Cortex Medicine channel. Okay, so this is the favorite topic of examiners: hypokalemia and hyperkalemia. A 60-year-old man with a history of chronic kidney disease present with muscle weakness and palpitation. His ECG showed peaked T waves. Lab tests reveal a serum potassium of 6.8 milliequivalent per liter. What is the most immediate next step in the management of this patient? So you see the CKD here. The complication, one of the complication of CKD is hyperkalemia. Okay, uh, so what is the first step in these patients? First, you have to stabilize the heart by the potential arrhythmias or to stop arrhythmic activity. Okay, so you have to give first 10 ml of 10% calcium gluconate over 2 to 3 minutes. Okay, and uh, you can repeat this dose. Okay, what is the other measures? The other measures is focused on rapid reduction of potassium. Okay, so first D50 50% of D50 का 50 ml लेना है plus 10 unit of 10 unit international unit of insulin. Okay, या 10 international unit of insulin you have to take this thing. Okay, after that uh, there is update international unit. Okay, there was a guideline in the internationally about the nationally about the pharmacy in the pharmacy that you now must have to use full form of these things. International unit instead of IU, IV की जगह intravenous and IM की जगह intramuscular. You have to write it fully in the prescription. Okay, if glucose is in this question, if the patient glucose is around 200 to 250, insulin can be given without the glucose, and but you have to monitor the glucose for the potential hypoglycemia. The other measure is the salbutamol, which is a short-acting beta agonist, or 10 to 20 mg of salbutamol in the 4 ml of NS. Over 10 minutes, you have to nebulize it. The side effect of salbutamol is increased glucose and increased tachycardia. Remember, in the 10% patient of ESRD, they are resistant to salbutamol alone. So you have to give the insulin plus salbutamol together, and this has a additive effect. Okay, the Harrison wrote this. This has a additive effect. Okay, so use both. Okay, in 20% of patient because they respond, they do not respond. Okay. Second measure is the to rapid reduction of potassium is the soda bicarb. There is no acute role on treatment. It will take 4 to 6 hours. Okay. Second thing we can do is the removal of potassium by the action resins, by using diuretics, and by using dialysis. It is ultimate. The action resin that is famous is SPS, sodium polystyrene sulfate. It is the fatal complication of this is intestinal necrosis. Okay. Alternatively, you can use petiromer. Okay, the side effect of petiromer is hypomagnesemia. Okay, and sodium jerconate 9, JS9, famous by this. Next is ECG of hyperkalemia. This is the ECG. You can remember by this. Okay, what are the drug? What are the things that cause hyperkalemia? Acidosis, digoxin, ACE inhibitor, ARB, renin inhibitor. These all that cause hyperkalemia. Okay, so widen QR is just remember this is the ECG and someone is stretching it. Okay, if someone is stretching it like this, the T wave become peak T wave. This will become widen QR. The P will become flat P wave, and the PR interval will be prolonged. Okay, remember by this trick, and you will never forget. Okay, second is hypokalemia. You have to just push. Hypo means down. You have to just push the wave below side. The T wave will invert, and the P wave will rise, and this is known as pseudo P pulmonale. Okay, this is important. Pseudo P pulmonale is seen in hypokalemia. This is a previous year question. There is one more important thing, that is hypokalemia and hyperkalemia. In the hypokalemia, remember by hypercalcemia. Okay, it causes the shortening of ST segment. Okay, or in the hypocalcemia, a QT segment is prolonged. Okay, done. This is done. Uh, hypokalemia, just like acute symptomatic hypokalemic patient like presenting tetany or all these patients. Remember this hypocalcemia means QT is prolonged. Okay, patient is doing again, goes into tetany. Okay, so you have to give 10 ml of 10% calcium gluconate with 50 ml of D5 or NS over 5 minutes followed by infusion. Okay, this is for hypocalcemia. Okay, you have to give calcium. In the chronic hypocalcemic patient, secondary to like hypoparathyroidism, you have to give calcium supplement plus D2, D3 or calcitriol. For the hypercalcemia, if there is significant symptomatic hypercalcemia, lead to actually hypercalcemia lead to dehydration. Okay, so if patient has significant hypercalcemia, sympathetic hypercalcemia, symptomatic hypercalcemia, actually you have to give 4 to 6 liter of IVNS. Okay, 4 to 6 liter of NS in first 24 hours, and keep in mind that patient not goes into congestive heart failure. Don't use loop diuretic until volume status become normal. Actually, you are giving fluid, and if you give diuretic, all will wash away. Okay. So in hypercalcemia case, if bone resorption is the cause, we have to give bisphosphonate. That is most important. That is, I think, drug of choice, or calcitonin denosumab. Denosumab is a rank lang ligand inhibitor, rank L. Okay, it is the antibody to rank ligand. Okay, remember this RNKL. Okay, gallium nitrate also used if hypercalcemia is secondary to 125 or dihydroxy-mediated hypercalcemia. You have to give glucocorticoid. Remember this. If patient is written that hypercalcemia is mediated by secondary to 125 hydroxy mediated, you have to give glucocorticoid. Okay. There is one important extra is here. What is the cardioselective beta blocker? Because beta blocker is mentioned here, salbutamol. So the trick is be selective about your man-bab. Okay. So you remember by this. This is mnemonic: metoprolol, atenolol, nebivolol, bisoprolol, acebulol, betaxolol, esmolol. Okay. The labetalol. Another trick is labetalol. Just simply remember that alpha A comes first in this labetalol spelling. Okay. ये पहले आ रहा है, ए कम्स फर्स्ट, तो ए के साथ में क्या लगाना है फर्स्ट, तो इट इज द अल्फा वन ब्लॉकर एंड बी फॉर बीटा नॉन सेलेक्टिव blocker. Okay, now I hope your concepts are clear by this video, and I hope you can easily do questions. Thank you. Keep following, keep sharing.